Hello, I'm Dr. Karim Kurji, York Region's Medical Officer of Health. We're seeing more and more cases of the variant now in York Region. As of today, we have 15 confirmed cases, of whom we've been able to get details on all except one, and 9 of these 15 have acquired it locally. They don't seem to have any association with travel histories. This is not good news for us, and we know that the labs are going to be sending at least another 3 more to us to investigate. It's very important now that we try and manage the spread of this variant, delay it as much as possible, hopefully until such time as we have all been immunized, which is going to be an almost impossible task. So it's important that we collectively work towards ensuring we're following the same physical distancing guidelines. Remember, a close contact is someone who breaches a distance of 2 meters for 10 minutes or more. Now, this variant happens to be one that is very easily transmitted. So we, on the public health management side, are being a bit more aggressive to slow down its progress. So it is very important that you follow the physical distancing, the masking, and all those other guidelines to ensure the spread of it is controlled. Remember, you're expected to stay at home because the province's order of staying at home is in effect and will be in effect until February 11th. This means only go out for essential visits like to the pharmacist, to your healthcare provider, grocery shopping, or to work if you're an essential worker. And businesses also should take steps to ensure that those folks that can work from home are working from home. Right now, the supply of vaccines is somewhat limited given the disruption in the Pfizer vaccine supply chain. We have largely immunized the long-term care homes and retirement homes with our hospital partners, EMS partners, and physicians and nurse practitioners in the community. We are just starting to immunize those same folks with the second doses, as one requires the second dose to get optimal levels of protection, particularly for the long-term care and retirement home residents. You can find out more about the vaccination program from our website, york.ca/COVID-19 vaccine. We will be endeavoring to reach other priority groups as and when the opportunities present themselves, which is largely a question of having enough vaccines. Earlier on in the pandemic, we were seeing close contacts living in small households. However, more recently, we have found that the households seem to be bigger households, and more transmission has been occurring in those places. So in order to facilitate close contacts being able to isolate more safely, York Region has established a voluntary isolation center. When we talk about folks that need isolation, these could be cases of COVID-19, these could be individuals who are waiting for test results, or it could actually be close contacts of cases. So anyone who feels that they cannot safely isolate in their home setting because of the limitations perhaps, please get in touch with our isolation center. You can reach us through the website york.ca/isolation center, or you can call Access York at 1-877-464-9675. The service is provided free of charge for eligible residents, and assistance can be provided to obtain assistance with rent, utilities, and food for eligible individuals, should they require that. Finally, I want to remind you, international travel is only for essential purposes. Please be kind to our investigators when they call you. And please respond to our text messages asking you to complete certain surveys, because that helps us speed up the process of getting in touch with your close contacts. And please remember all the guidelines we've been giving you: washing your hands frequently, physical distancing by 2 meters or more, wearing masks, not going out at all if you have got mild symptoms, accessing testing if you suspect that you may have acquired COVID-19. By being vigilant, we can get through this more safely together. Thank you, and stay vigilant.